Too often we think of cancer as just a medical experience. We talk about chemotherapy, radiation, immunotherapy, all sorts of hospital treatments. But we all know that cancer is personal. You two, in your own way, have dealt with cancer patients and family of cancer patients and caregivers in your career, and I'm really interested in discussing what is the impact of cancer at the personal level. I know how we talk about cancer really affects people and their families. And too often we talk about people fighting cancer and they lost the fight. Right. And there's been a lot of response to that says, you know, they didn't really fail. We shouldn't set it up so that people think they're a failure if they don't survive their cancer. How do you talk to patients about what their mindset should be as they go into the experience of cancer?
I try to focus on what I have found is one of the biggest issues with everyone, which is loss of control and the fear of that. You know, it's loss of control over your body, over your life, over your financial situation, over your family. And I try to put them in the mindset that even though this seems overwhelming and it seems like, you know, something has just hit you out of the blue and it's taking over everything, that you still have control. And try to show them the ways that they still have control and try to explain the therapies and the things that they're going to be going through as ways that they and we working with them are exerting control over the disease itself. And I think that's really, really important because, you know, feeling helpless, feeling that there's nothing I can do or something's happening to me and I can't do anything about it, I think is one of the most difficult challenges that people with cancer deal with. And it's because of this idea that it's a battle and it's win or lose and, you know, it's so much pressure. I also try to focus on, you know, really the day-to-day and setting expectations and goals that are short-term rather than focusing on, as you said, like the ultimate battle.
So Carla, Family Reach does a phenomenal job of helping people with the financial challenge of going through cancer treatments and clinical trials and other things.
Right.
I've heard you say that sometimes people don't believe you because it sounds too good. What's your experience with what people assume and versus what actually can happen in terms of the support system that can be created around cancer?
And I'd like to piggyback what Carol said. When cancer strikes, it is your focus, cancer. And work is interrupted and income is cut in half. If it's a single parent household, it's cut by 100%. But the focus is still on cancer. Life, as you know, it stops, but the bills keep piling in. You know, the rest of the world doesn't stop, you stop. So families just really fall under that huge pile of financial burden and stress and strain. And they think there are no resources and that there is no help because the focus is cancer. But there are many entities and pharma companies and so many programs that can help with the financial piece of cancer. So I think people are afraid to say anything, so all the help goes untouched. So it's really important for people to speak up, know that they're not alone, know they did nothing wrong, and that cancer will wreak financial havoc on you, and there is help.
I know there's a stereotype that when people have cancer, everybody rallies around them and the family gets stronger, but I think we all know that sometimes that's not the case, and that sometimes it can lead to divorce, it can lead to family problems because of the strain on the family. What inspires you about the kinds of support that you've seen that recognizes how complex this is? And when you find people who don't have that social support system, what can we do for them?
Well, I think it's really important for people with cancer to realize just what you said, that sometimes the people that you've been depending on or that you yourself have been supporting all this time are not going to necessarily be the best people to support you through the experience because it's affecting them as well. And so one thing that I try with all of my patients is no matter what their family support seems to be, I try to connect them with another person, either somebody they know or someone that we can connect them with that has cancer or that has dealt with this. Because very often finding a support or someone to talk to that shares the experience that you're not related to, that you don't have these other bonds with, but that you can trust and can help be a sounding board, advise you, I've found that that can be really helpful. And then obviously for people who don't have the family support. And then the other thing is what Carla was saying, to understand, and for the patients to understand that, you know, where they're getting their care, there are a lot of resources to help support you.
Carla, what role does pride play in people resisting financial help just out of pride?
Such a great question. There's this group of folks that don't know it's available, and there's other that are just too embarrassed to ask. And you know, we see a lot of the middle class, upper middle class are actually end up filing for bankruptcy, 20% fall below the poverty line because of pride. We talk to parents all the time that say, I am the breadwinner, I can do this. You know, they say, I got this, until they don't, and until they start to see that their ability to access care and adhere to treatment is being jeopardized. So these financial barriers are literally affecting their chances of survival. So pride, you need to check that and know that a majority of cancer patients will experience cancer-related financial toxicity. It's actually the norm. So put the pride aside, make sure your treatment is not interrupted and not jeopardized. 36% of patients are actually cutting their meds in half to make them last longer so that they don't have to raise their hand and say, I can't afford this or I can't do this. So those dangerous decisions, when they're connected to pride, are just unnecessary. So pride is a really, really big piece.
When I was diagnosed with leukemia, I had a year between my diagnosis and my treatment. I didn't tell my mother. I told my wife, my children, my sister, and my business partners, and a few close friends, but not everybody, because I didn't want them to worry about me, especially my mother, because I knew she'd call me every day. But when I started treatment, I told my mother, and then she called me every day. How do you counsel people about how to share what they're going through and how to help them navigate the societal aspect of it?
I counsel them that, just as you did, first look at who is their immediate support system, group of friends, people they interact with on a daily basis, and make a decision, much as you did, about who should I share this information with, what are the pros and cons. And I don't try, except in the case of children, I don't really try to make that judgment for the patient. If they say, I'm not gonna tell my mother because I'm worried about her, she's elderly, then I go with that. The one area where I often counsel patients that it probably is better to share something is when they have children that are old enough to understand that something is not right with mom or dad or grandma, but the parents think that they're shielding them from something. And I always tell them that, your kids know that something's wrong. And if you don't tell them something, they're gonna imagine 1,000 times worse than the reality is. So if you just say to your child, well, mommy's sick, she's going to the hospital, and you don't tell them anything about what's gonna happen to her there or when she'll be back, they're gonna worry every night that she's not coming back. And so it's that kind of thing, I think. But I think it's a really great idea to be able to decide, who am I gonna share this with? I think the important thing is that it's best if you have somebody, and maybe hopefully more than one person that you can share it with from the beginning, so that you have people that you can rely on, even to manage the information sharing with others in your circle. For those people who feel they really have no one, I often will really sit and probe that person and say to them, I've had many patients, I don't have anybody that can bring me to surgery. And I'm like, well, let's talk about that, And then sometimes you'll find that they do have someone, but they just want to shield them.
So let me ask each of you one last question. I'm going to start with you, Carla. You mentioned that, cancer becomes the focus. But the fact is, their life does go on. And we know that people who continue in their life, in their work, if they can, do better than people who obsess about their treatment or obsess about their cancer and stop everything else. What's the one guiding principle that you would tell a newly diagnosed cancer patient about their life during their cancer experience, apart from the medical side of it?
My goodness, that's quite a question.
It is.
I see two very different sides of cancer. I see there's the pediatric, and you alluded to they're so different. There's pediatric cancers, and then there's the adults that have cancer. And when a child is diagnosed with cancer, the world does stop for the parent. And nothing is going to get in the way of them giving that child every chance to get on the other side of cancer. So they bar nothing. When it's the adult that has cancer and there's children in the home, they're the ones that are taking shortcuts. They're the ones that are putting off scans, putting off filling meds, and when we ask them, they say, I have to pay my mortgage. I have, 2 or 3 kids to keep a roof over their heads. So to answer it's sort of two different scenarios, so 2 different answers. But for the adults, you do have to take care of yourself so that you can beat cancer. And taking these shortcuts to protect your family, you have a better chance of losing your battle. So this is when you need to raise your hand, ask for help, because there's help out there.
I think that if adults with cancer could realize that it's okay and that it's very important to try to continue to participate in important life events. A simple and silly example that I found is that very often when patients are starting treatment or scheduling their treatments, they won't say anything to their physician about, well, 3 weeks from now, my daughter is graduating from high school, or my cousin is being, confirmed or something. It's all about this kind of experiencing every moment and trying your best to take the best out of every moment. So I think that's one bit of advice that I do give to the adult patients, and try to help them recognize that everything doesn't have to stop. A few days, a week or 2, sometimes for scheduling a treatment or doing a surgery is not gonna matter. But if it means that you were at, somebody's high school graduation, that's, a lifetime of importance.
When I was a child, a long time ago, there was a TV show called The Millionaire. And this fellow would show up to families that needed help and give them a check for $1 million. Now, back then, that was a lot of money. Today, it'd be about $20 million. Each of you, in your own way, are the millionaire, because you show up when people need help, and you provide very different kinds of help, but it's all part of the same thing, which is giving patients hope. And I think if there was one thing I would say about what is beyond the patient medical experience, it is that if you look for it and if you hold up your hand, there are people like you two who can show up to give people hope. And we're all very grateful for it.